If you found this video, there's a good chance you're dealing with neck pain, back pain, or you're simply trying to understand your options. Maybe you've already seen multiple doctors. Maybe you've been told you need surgery. Maybe you've been told you don't. Or maybe you're just trying to make sense of why your body isn't letting you live the life you want to live. Whatever brought you here, I'm glad you're here. My name is Dr. Leonard Kibuule, and I'm an orthopedic spine surgeon. But that's not where my story begins. People often assume that I always knew I wanted to be a physician. The truth is, I didn't. Long before I ever stepped into an operating room, I was fascinated by how things worked. I was the kid who liked taking things apart just to see what was inside. I loved solving problems. I loved understanding systems. That curiosity eventually led me to study electrical engineering at the University of Texas. During college, I had the opportunity to work with companies like IBM and Hewlett-Packard. Those experiences were incredible. I learned how great organizations solve complex problems, how innovation changes industries, and how technology can improve lives. But as much as I enjoyed engineering, something was missing. Engineering allows you to build amazing products. Medicine allows you to change someone's life in a way that's deeply personal. At some point, I realized that what excited me most wasn't simply solving technical problems, it was solving human problems. I wanted to work directly with people during some of the most difficult moments of their lives. That realization changed everything. So I made what many people thought was a crazy decision. I left engineering behind and pursued medicine. Medical school at UT Southwestern challenged me in ways I couldn't have imagined. It was demanding academically, emotionally, and mentally. But it also reinforced something I had already begun to understand. Medicine is one of the greatest expressions of service. It's a privilege to be invited into someone's life when they're scared, when they're hurting, or when they don't know what comes next. After medical school came residency and fellowship, where I eventually discovered the specialty that combined everything I loved: spine surgery. Spine surgery sits at the intersection of engineering and medicine. The spine is one of the most remarkable structures in the human body. It protects the spinal cord, supports our posture, allows us to move, and carries the nerves that control nearly everything we do. Every patient presents a unique challenge. Every surgery is different. Every decision requires balancing anatomy, biomechanics, technology, and, most importantly, the individual goals of the patient sitting in front of you. That's what drew me to this field. People often ask me what my favorite surgery is. The truth is, my favorite surgery is the one that gives someone their life back. Sometimes that's a minimally invasive decompression that allows someone to walk without pain for the first time in years. Sometimes it's a complex reconstruction that helps someone stand upright again. Sometimes it's helping an athlete return to competition. Sometimes it's helping a grandparent pick up their grandchild without fear. The operation itself isn't the reward. Watching people reclaim their lives, that's the reward. One thing I've learned over the years is that patients rarely come to me because they simply have an MRI finding. People don't come to my office because they have a herniated disc. They come because they can't sleep, because they can't work, because they're missing family vacations, because they're worried about losing their independence. Pain changes lives. As physicians, it's easy to become focused on images, scans, and test results. But I've always believed that my responsibility extends beyond interpreting an MRI. My responsibility is understanding the person attached to that MRI. That's why I spend so much time educating patients. I tell people all the time, you don't need to become a spine surgeon, but you should understand your own spine. When patients understand what's happening inside their body, fear begins to disappear. Knowledge replaces uncertainty. Confidence replaces anxiety, and together we can make better decisions. One of the biggest misconceptions people have is that surgeons want to operate on everyone. Nothing could be further from the truth. Surgery is simply one tool. Many patients improve with physical therapy. Others benefit from medications, injections, exercise, weight loss, or simply understanding how to move differently. If surgery isn't the right answer, I'll tell you. Because the goal isn't to perform surgery. The goal is to help you live your best life. Over the years, though, I found myself becoming increasingly frustrated not with patients, but with the healthcare system itself. Too often, decisions about patient care were influenced by insurance requirements, administrative hurdles, prior authorizations, and policies that had very little to do with what was actually best for the individual sitting in front of me. Patients would wait weeks or months for appointments. Necessary imaging would be delayed. Treatments would require layers of approvals. Time that should have been spent caring for patients was increasingly spent navigating bureaucracy. I knew there had to be a better way. That belief became the foundation for something very personal to me: POSH. POSH stands for Premier Orthopedic Surgery and Spine Health. For me, it's much more than the name of a medical practice. It's a philosophy. It's a promise. A promise that every patient will be treated with dignity, respect, honesty, and compassion. A promise that patients won't feel rushed through appointments. A promise that they'll understand their diagnosis, their options, and why we're recommending a particular treatment. Most importantly, it's a promise that they'll be treated like family. People sometimes hear the word concierge and assume it's about luxury. For me, concierge medicine isn't about luxury. It's about access. It's about communication. It's about responsiveness. It's about creating an environment where patients know someone is truly advocating for them. That's why we built multiple levels of care. For many patients, traditional office visits provide exactly what they need. For others who desire additional access and personalized coordination, we created POSH Plus, where patients receive enhanced concierge support throughout their surgical journey through our partnership with 365 Surgical. And for individuals seeking the highest level of personalized physician access, care coordination, and long-term wellness planning, we created POSH Platinum. The names are different, but the philosophy remains exactly the same. Every patient matters. Whether someone comes through our doors with Medicare, workers' compensation, private insurance, or chooses to pay directly for care, they deserve to feel heard. They deserve transparency. They deserve excellence. Looking ahead, I believe healthcare is entering one of the most exciting periods in history. Artificial intelligence, predictive analytics, robotics, advanced imaging, remote monitoring. These technologies are going to transform medicine. But here's what I hope never changes: the relationship between physician and patient. Technology should enhance compassion, not replace it. The future of medicine isn't choosing between technology and human connection. It's combining both. If you've watched this far, thank you. I know there are countless places you could spend your time. Whether you're a current patient, a future patient, a family member, or someone who's simply curious about my journey, I appreciate you being here. My hope is that when you think about healthcare, you don't simply think about procedures or diagnoses. I hope you think about possibilities. The possibility of moving again. The possibility of sleeping through the night. The possibility of returning to work. The possibility of playing golf. The possibility of lifting your grandchildren. The possibility of living life without being defined by pain. That's why I became a spine surgeon. That's why I still love what I do every single day. And that's exactly why I created POSH. Thank you for allowing me to share my story. I look forward to being part of yours.